that needs to do taping at home for Dequervains. So we have a piece that is probably 1, 2, 3, 4, 4.5 to 5 blocks long. You're going to take it and roll back the end of it. Make sure your skin is clean and dry. And you're going to anchor on the thumb just like this, like that, and stick it like that, okay? Then you want to pull these tabs off, just like so. And you're going to take the first piece of tape and you're going to drop your thumb down as long as it's not painful, and turn it away a little bit, and then that way you've got the tissue in a stretch. And we're just gently pulling this tape around that location where those tendons would be irritated. And you're going to take it all the way up the arm and then have no tension at the very end. Kind of difficult to do it yourself. And then same on this side, you can actually bring that tape all the way up and let it kind of catch the skin, and then go ahead and come back, take it down and over again, trying to give it a little bit of tension. It's about 25% tension, so it's not a lot. It goes up to the forearm, upper forearm. It doesn't have to go all the way to the elbow because those muscles do not come off the elbow. So then you've got this. So then you can take another piece of tape. So we do an assessment process. You can tell your patient to do the same thing. If they glide the skin this way and they do the repeated Finkelstein and they have less pain, then you would start your tape here and do a fascial Y this way. If they went this way, retested, and they felt better, go that way. Generally, my experience is they're going to be on this side and unload the tissue this way. If none of those directions work, you know, even if they've tweaked from like a 9 o'clock to an 8 o'clock or 10 o'clock, this is like a clock method. There's the pain is the center of the clock. It's 12, 3, 6, 9. So you find which direction they like the best. Once you go to 9, if it doesn't take all the pain away, but it's much better, go over to 8 or go to 10. Find the position. That's where you start your tape. If none of those directions help, then you go ahead and you lift the skin and check and see if that helps. So it looks like this, lifting, check the motion. If that's helpful, then you tear the tape in the middle and you just stick it straight down. So we'll do that one first. So patients can generally do this themselves. You can either start it where you stick it on the skin and lay it down. So I'll show you how that is. It's much easier if you're not doing it on a camera. So you can just anchor the tiniest little bit there. Then you're gonna take this tissue and pull it over, and then no tension at the end. Pull it this direction, no tension at the end. Or if they're really clever, they can take the tape themselves and rip it in the middle and actually put it on a little stretch by holding their fingers kind of like this, and then lay it down right over that location, and then take the ends off with no tension. The idea is that wherever you start the tape is where the tape will pull back to. So if you start it in the middle, it'll pull back to the middle and essentially lift that location. Same thing here. Fold back the little tabs. Put your fingers between there, separate them, and then hopefully you guys can see that. Just like this, like that, and like that. Little tension. So then you've got this nice lift. Retest them, make sure that they have less pain. Now, if you wanted to change it up from a directional perspective, you're going to take another piece, position right there, and they liked how that felt, but they didn't like 10 o'clock. If you make your piece so wide, then you're going to influence both those. You want to be exactly where they like it. So if we went like this, they retested and they liked it. Sorry, you can't see very easily. Then we're going to tape it the same way. So generally, you make this Y very small. It could even be smaller than this. And you're going to anchor it over here, maybe around 9 o'clock. You're going to put them on as much stretch as they can tolerate without pain. And then you're going to bring this off, pick it up, little tension, no tension. Pick it up, little bit of tension, no tension. And then you have this nice little unwinding in that direction. If you needed to go up to the elbow and unwind up here too, if you touched up here and the radial head felt better, or the fascia, if you're very light and the fascia feels better there, you can do a Y that is up there as well. This is a good one for tennis elbow.